Good evening, and thank you for joining tonight's Power to End Stroke Cleveland special event. I'm Valerie Hillo-Gates, Executive Director of the American Heart Association and American Stroke Association for the Greater Cleveland community. For those of you who are new to this evening's event and may be wondering, the American Stroke Association is a division of the American Heart Association. Each May, during National Stroke Month, we put a spotlight on stroke. We highlight the warning signs and risk factors and how you need to act fast. That's FAST, and we'll hear more about that later. May comes during the spring, which we all know is a time that signifies optimism and renewal. In that vein, the theme of tonight's event is Reclaim Our Rhythm and Soul. As you know, we haven't been able to gather for this important event during the last 2 years when our lives changed. The last 2 years have not been easy. Some of us lost a loved one to COVID. Some of us had job changes. And some of us neglected our own health, perhaps due to other pressures or priorities. But tonight, we gather. We aim to move forward with a conviction to heal our souls and to get back into the rhythm of things. We are reclaiming what matters most to us: our physical health, our mental health, and our well-being. This evening, we're going to hear from physicians on the cutting edge of stroke care. We are going to be entertained by Grammy-nominated musicians. And we are going to get our bodies moving and have some fun. Now, I will turn it over to Reverend Howard to get things started this evening.
Good evening. Let us pray. O Heavenly Father, you have filled the world with beauty. Open our eyes to behold your gracious hand in all your works. We thank you, O God, for the great work of the American Stroke Association. This organization is providing thousands of people hope and purpose. O God, please continue to give the association the strength and direction to continue to be a beacon of light in these seemingly dark times. We will continue to move forward with joy in our hearts for the good things you have done. In your mighty name we pray. Amen.
What I can have. I expect a miracle. I expect a miracle. Every day, God will make a way. Out of no way, just believe and receive it. 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 God will perform it today. Hey, hey, just believe and receive it. God will perform it today.
Thank you to the Cuyahoga Metropolitan Housing Authority Choir for lending your beautiful voices this evening to start our show. Next, I'm going to introduce you to our featured speakers this evening, but I want to let you know that your mics and videos are muted, so you may just listen along. However, we will have time set aside after our presenters to answer your questions in a live format. We have 3 physicians joining us from Cleveland Clinic's Neurological Institute. Dr. Abbas Karal is a staff physician in the Cerebrovascular Center. He has a special interest in community health and stroke prevention, which stems from his background in public health and serving stroke in young adults and diverse populations. Dr. Gwendolyn Lynch is a staff physician and is board certified in neurology, neurocritical care, and vascular neurology. As an attending physician in the neuro ICU, she is responsible for the management of patients with critical vascular disease as well as other neurocritical illnesses. Dr. Shazam Hussain is a board-certified neurologist with specializations in vascular neurology and endovascular surgical neuroradiology. He is the director of the Cerebrovascular Center and an associate professor of neurology in the Cleveland Clinic Lerner College of Medicine. He has more than 200 peer-reviewed publications and is considered an international expert in cerebrovascular disease. Dr. Karal, I will turn it over to you first.
Good evening. On behalf of the Cleveland Clinic Cerebrovascular Center, I would like to welcome you all today to today's event, where we'll be talking about an update on stroke treatment and prevention. I would also like to thank the American Heart Association for this opportunity and for gathering us here today to talk about this very important topic. My name is Abbas Karal, and I'm a cerebrovascular neurologist here at the Cleveland Clinic Cerebrovascular Center. And I will be talking to you today about advances in stroke treatments for what happens to a patient when they present with acute stroke symptoms or new stroke symptoms, and what goes on in their evaluation in that first hour after presentation, or what we call the golden hour of evaluation after stroke. Following that, my colleague, Dr. Gwendolyn Lynch, who is a neurologist and neurointensivist here at the Cerebrovascular Center, will be talking to you about what happens to a stroke patient when they're admitted to a neurological intensive care unit. Following that, my colleague, Dr. Shazam Hussain, will be talking to you about stroke prevention. So let's get started. The burden of stroke is massive. Stroke is the #1 leading cause of long-term disability in the United States. It's the 5th leading cause of mortality in the United States. There's a 25% estimated lifetime risk of stroke in those ages greater than 25 years. But most importantly, stroke is largely preventable and treatable. So Miss Legesweek is a 50-year-old woman with a history of high blood pressure, diabetes, and smoking. She was found by her family member to have drooping of her face, slurred speech, and right-sided arm and leg weakness. 911 was called and an ambulance was dispatched. Now, before we dive in, there are 2 important stroke types that we need to know about. One is an ischemic stroke subtype, which is what we see in the majority of strokes, comprises about 85% of all strokes, and is caused by a blood clot that's blocking one of the blood vessels to the brain, and therefore blocking oxygen and blood supply to the brain. The sooner we can bust that clot, the sooner we can restore the brain's function and improve outcomes. The other type of stroke, which is seen in about 15% of cases, is a hemorrhagic stroke in which bleeding occurs into the brain. The American Heart Association emphasizes that we spot a stroke fast. So when you see someone with face drooping, arm weakness, or speech difficulty, it's time to call 911 immediately. So what happens when someone calls 911 with alerting them for someone with new stroke symptoms? A mobile stroke treatment unit may be dispatched. What is a mobile stroke treatment unit, or MSTU? This is an ambulance that has all the essential equipment and team members needed to evaluate a patient who's presenting with new stroke signs and symptoms and determine if they're eligible for a clot-busting medicine. Firstly, it also determines if they're having an ischemic or hemorrhagic type of stroke by way of getting a CT scan of their brain, and there is a CT scanner right in that ambulance. And once a stroke neurologist who streams in to evaluate that patient can evaluate those images, examine the patient, and determine if that patient is eligible for that clotbuster medicine. And that clotbuster medicine is given right there and then in that ambulance by the paramedics who have that medicine on board without wasting a single minute. The essential principle of what mobile stroke treatment units act upon is that time is brain. Every minute that the brain is deprived of blood supply and oxygen, 2 million neurons are lost. The benefits of mobile stroke treatment unit are significant. We know that patients transported by a mobile stroke treatment unit are more likely to receive a clot-busting medicine compared to those transported by regular ambulance. They have a 10 times higher chance of receiving the clot buster within 1 hour and are more likely to have full recovery at 90 days. So what if a mobile stroke treatment unit is not available in that area? Then that patient is evaluated by a regular ambulance and is transported to the nearest stroke center. Most often a primary stroke center where an emergency room team activates a telestroke neurologist who evaluates the patient in that emergency room via video capability. And then that patient is sent immediately for brain imaging, and that brain imaging is interpreted by the stroke neurologist. Again, emphasizing that time is brain. We need to act very quickly in this golden hour of stroke. There are several important questions that we ask in this golden hour of stroke. Firstly, we ask, is it an ischemic stroke or a hemorrhagic stroke? And if it's an ischemic stroke, we ask, is the patient eligible for a clotbuster medication? Is there concern for blockage in a large blood vessel? And lastly, is there brain tissue that can still be rescued with surgical clot removal if needed? Tissue plasminogen activator is a clot-busting therapy we give, and it's given within 4.5 hours of symptom onset. It can be given up to 9 hours with advanced imaging that is available at some comprehensive stroke centers. We know that patients treated with this clot-busting medicine are 30% more likely to have little or no disability at 3 months. Again, emphasizing how important it is to seek treatment early, and once treatment is sought, to operate as early as possible. The next question we ask is there still a blockage in a large blood vessel in the brain? If so, we obtain special imaging to look at that blockage, and then we ask, is there brain tissue that can still be rescued? And as you can see here in this advanced imaging, we're looking at this area in green that is a significant area that can still be rescued. Now, if the determination is made that there is a large blood clot and there is still a lot of brain to be rescued, that is when we call in the endovascular neurosurgery team, who can go in and remove that clot surgically. Now, if an endovascular neurosurgery team is present at that facility, then the patient will go straight to the operating room. But if endovascular neurosurgery is not available at that facility, then that patient will be flown to a comprehensive stroke center via a helicopter or a ground ambulance. And what the endovascular neurosurgeons can do is go in through either the leg artery or the arm artery with the help of a catheter and remove that clot immediately. We know that in those patients who have a big blood clot sitting in their arteries of the brain, there is a significant benefit. We know that they have a 5 times higher chance of functional independence at 90 days. And we know that there are better outcomes in younger patients, those with smaller stroke size at initial presentation, those who received the clot-busting medicine early, and those who underwent surgical clot removal early. Now, again, emphasizing, if the symptoms are recognized early, 911 is called early, the teams are activated, either a mobile stroke treatment unit is there to give that clot-busting medicine and or transport the patient to a place where they can get the clot-busting medicine. And the determination of whether or not there's a big clot in one of the larger arteries of the brain, and if surgery is needed because there is still a lot of tissue to rescue. as we act as soon as possible and as quickly to restore blood flow to the brain, we see that we have much, much better outcomes. After these acute treatments, the patient is admitted to the neurological intensive care unit. Now, what if it's a hemorrhagic stroke, meaning bleeding in the brain? Well, the first thing we ask is, what caused it? Is the blood pressure too high? If so, control it. Is the patient taking a blood thinner? If so, reverse it. Is there an aneurysm? If so, then fix it. Is there a bleeding disorder? If so, then correct it. And for all of this, the patient is admitted to the neurological ICU for further treatment. My colleague, Dr. Lynch, will talk to you more about what happens to these patients once they're admitted to the neurological ICU. Dr. Lynch?
Thank you, Dr. Corral, and hello, everyone. I'm delighted to talk to you today about how we take care of patients with stroke in the neurocritical care unit. For those of you who might not know about it, the neurocritical care unit is an intensive care unit dedicated to caring for patients with severe and immediately life-threatening neurological and neurosurgical conditions. Neurocritical care is a relatively new medical specialty, and because of that, many people are not aware of us and the care that we are able to provide for our patients. Many of our patients need intense medical care to stay alive and to keep their brain and other organs functioning on a minute-to-minute basis. Because of that, many of them are on continuous intravenous medication to manage their blood pressure, or they're on ventilators or special breathing machines to get life-saving oxygen to their body. Many of our patients are fragile, or as some would say, in a touch-and-go situation, and they're all required to undergo close monitoring of their vital functions, including heart, lung, and other vital signs. Patients with acute stroke make up a large portion of the patients that we take care of. And in fact, acute stroke patients were one of the main reasons that neurointensive care units came into being. In the beginning of this field, and for a number of years, we were able to offer only special expertise of basic heart, lung, and brain monitoring. Yet even with just that, in combination with the special attention and wisdom of the neurocritical care specialist, the care of these patients was dramatically improved. But we didn't stop at that. In fact, over time, as researchers and clinicians have figured out better and better ways to take care of patients, we've accumulated many more treatment options and better ways of monitoring our patients. As a result, we're seeing more and more patients not only survive, but also thrive as compared to what we saw decades ago. For example, in the past, we knew that certain patients needed to receive temporary intravenous treatment to increase their blood pressure and blood flow to the brain. But the process for many was complex and at times high risk. Now, we're able to monitor and more effectively treat many of these patients very well using a special device that is less risky and more user-friendly. Another example deals with brain monitoring using an EEG or brainwave measuring machine. In some patients, their ability to wake up and function is damaged. And we know that many of them can have seizures that don't cause the typical shaking seen with many seizures, but their seizures can simply keep them from being able to wake up and move. And this can hinder them from recovering from their stroke. In years past, we could only detect these silent or subclinical seizures, as we call them, on a few cases because the EEG machines were expensive and large. We had only a few per hospital, and we could only use this device for a few minutes or an hour at a time. Now, with advanced technology, the devices are smaller, portable. We have nearly 10 times more of them available to monitor our patients, and we're able to run the EEG monitoring for 24 hours a day for days on end if needed. It has really changed how we care for our patients in a major way. Whenever a person suffers a stroke, brain swelling develops. This is minimal with small strokes and doesn't make matters severely worse. But a large amount of swelling develops with a large stroke. With this large stroke, the swelling can be life-threatening. In the neurointensive care unit, we monitor our patients with large strokes for this life-threatening brain swelling. And if needed, we provide treatment to save our patients' lives to prevent more complications when severe brain swelling develops. When I trained for this in the mid-1990s, there were only a few things that could be done to manage this severe brain swelling. We now not only have more options to treat our patients, but we also have a better understanding of this problem and better protocols for treating this problem. So in recent years, we've seen many more patients survive this life-threatening situation. Well, typically, when a person is admitted to the hospital, they're expected to lay in a bed and relax all day or most of the day, particularly in the intensive care unit. However, in the past 15 years or so, we've changed that approach because we now know that the body heals far better when it is mobile. So gone are the days when most of our patients lay in the bed with minimal movement for days or even weeks on end. When it is deemed safe, we now get our patients moving, either in the bed, at the side of the bed, or even standing and walking in the unit, even for some patients who are awake and still on a ventilator, believe it or not. We do this because we know that it gives them a better chance for good return to independent function. Now, have you or one of your loved ones suffered a serious medical problem, and after they're in the clear and starting to feel a little better, you thought, how did this happen? What was the cause? Well, in addition to treating stroke complications in our unit, we also get to work almost immediately on finding out the cause of the stroke. Stroke can be due to a number of causes, including clots from the heart, hardening of the arteries to the brain, and clots forming within those hardened arteries, damage to brain vessels due to the chronic effect of high blood pressure, brain aneurysms or sickle cell disease, or even inflammation in the blood vessels of the brain. We investigate for the cause by doing a number of medical tests, including an EKG as shown here, to look for abnormal heart rhythms like atrial fibrillation. A heart ultrasound is used to look at the heart structure and pumping function. Keep in mind that atrial fibrillation and heart structure abnormalities both can cause a clot to be pumped up from the heart up to the brain and cause a stroke. We also look at the brain vessels with a special CT or CAT scan to look for hardening of the brain arteries and other conditions. Many of our patients will need to undergo a brain angiogram, which is like a heart catheterization or cardiac cath. But instead of looking at the heart vessels, it allows specialists like Dr. Hussein, who will speak to you in a few minutes, it allows them to look at the brain vessels in greater detail for potential stroke-causing abnormalities. We also investigate by doing a number of blood tests. After this series of tests are done, we're able to either rule in a cause or at least say that we know that the stroke is not due to the common stroke causes that I mentioned earlier. So, with the cause identified, we can then decide to either provide treatment with aspirin and aspirin-like drugs to prevent a future stroke, or we tailor the treatment to another medication to prevent stroke, such as a blood thinner like warfarin, which is often used to manage atrial fibrillation. Once the patient has been stabilized and is able to leave the intensive care unit, they are transferred out to a hospital nursing floor bed or to a recovery facility where treatment is continued. You'll learn more about this from Dr. Hussein. And with that, I thank you for your attention, and I'll hand the mic over to Dr. Shazim Hussein. Dr. Hussein?
Great, thank you, Dr. Lynch. And so we're going to continue the journey of our patient. She's going to now go to an inpatient rehab hospital where she'll spend 2 weeks recovering and then returning home. And so that can allow us to then go into our discussion around stroke recovery. So real important message that I want everybody to leave here today with is that recovery is very possible after a stroke. We have a lot of great stories from stroke survivors, people that have returned either to normal or near to normal and really are getting back to their normal day-to-day function. And when we talk about recovery, we talk about two main components to that. That is time as well as therapy. We talk about the majority of recovery occurring in mainly the first 3 months, but this can actually occur up to a year or more in these situations. So although we love to see the recovery very, very quickly, important to keep encouraging our patients and our loved ones that recovery is still possible after a period of time. It often can be frustrating when things don't come back right away, but really important that they continue with that process. And then again, therapy is really, really critical in these situations, whether we're talking about physical therapy, occupational therapy, speech therapy, or other types of therapies. These can help and aid in the recovery. And so what we do see in the hospital then is we do make assessments of our patients, trying to understand where is going to be the best place. Ideally, we would of course love to get all patients to their home environment as soon as possible. And the majority of patients actually can go into these home environments, and sometimes they will need a little support like outpatient therapy or even home therapy. However, there are a set of patients, of course, who have more significant deficits where it would not be necessarily safe to get them back to home, in which case we do have the options of inpatient therapy and sometimes skilled nursing facilities for those that may take a little longer to recover. So a lot of really great options, though, that all kind of work to help getting the patient ideally recovering as soon as possible and back to their normal situation. In addition, we want to make sure that there are regular appointments with the medical team. We talk about this journey of the stroke patient taking a year, again, even longer. And those regular appointments typically involve a neurologist that was involved with the stroke care, your primary care physician, who's going to be very, very integral to the care delivery, as well as other specialists depending on the situation. For example, if we find some kind of heart condition that might be related to the stroke, a cardiologist might be involved. And important also in the stroke recovery conversation is that we spent a lot of time over the years really focusing on the physical recovery, but it's becoming more and more apparent how important cognitive recovery, as well as the psychosocial implications of having a stroke, even when someone physically returns to normal. And so it's important, and this is something that's under ongoing development. People are recognizing this and providing better ways for patients to recover and be able to adapt and adjust to the fact that they've had this illness. Also very, very exciting time in terms of research in this area. So many exciting things happening in the area of stroke recovery, all the way from things like robotics. We see there the picture in the middle. Dr. Ela Plow is doing work with transmagnetic stimulation using magnetic waves to help aid in stroke recovery. And we have even new surgeries and therapies that can be offered. This is the picture on the end there shows a little device that can be placed in the back part of the brain called the cerebellum, which can help and aid in stroke recovery, led by our chairman, Dr. Andre Machado. Now, I also want to take a moment and talk about the caregivers in this situation. These, of course, people, their loved ones take a lot of the care of these patients after they've had a stroke. And so it's important that these caregivers, we know that when caregivers are engaged and involved with these situations, that patients do much better. So with the caregivers, really, really important, those of you that are caregivers, make sure that you're talking to the medical team. The patient obviously has their questions, but equally important are to make sure the caregivers have their questions answered as well. Feel free to, of course, participate in the rehabilitation and in the care of the patients. These really is helpful in their recovery as well. And then also, we recognize that this is a great strain on caregivers. This is a situation that you're also feeling a lot of burden in. So be aware then of how to monitor yourself and take care of yourself for symptoms of burnout. Be aware of signs and symptoms of depression. Join support groups, many great support groups that are out there. Self-care, of course, can keep you energized. And really important, of course, in our society, this is something that we don't do as much as we should, and always enlist the help of others as you need to, because it's really important that the caregivers are also taking care of themselves so that you can be at your best to take care of your loved one. And then the last component of the talk here, I just want to talk a little bit about how stroke overall, let's go back to a general discussion around stroke. Stroke is very much a preventable disease. People often thought of it as something you couldn't do anything about, but we understand now that 80% of strokes are actually preventable. And how do you do that prevention? You got to work closely with your physicians and your care team. Make sure that you know your risk factors and potentially then control those risk factors if ones are found. And we talk about the 6 major risk factors that we have under our control. And these are things that are medical, things like high blood pressure, high cholesterol, and diabetes. Make sure that you know yourself if you do have those conditions, get screened for them. And if you do have them, work closely with your medical team to make sure they're under good control. This can have a great impact in preventing strokes in the future. We talk about smoking. If you smoke, quit. There's no good reason to smoke, just quit. And physical inactivity, of course, is another one. We talk about the importance of exercise and diet. Eating and exercising and leading a healthy lifestyle can have a significant impact on our health, both to prevent strokes, but also just to keep a good well-being overall. This, I promise, is the only graph that I'm going to show in this talk. We see here, I wanted to show that, you're of course going to look at all the different risk factors that are there, but if you had to pick one risk factor that would prevent strokes, you see there high blood pressure is the most significant when it comes to stroke. If we were able to control everybody's blood pressure in the United States, we would eliminate half the strokes that occur in the country. So very, very high impact. So if you're going to just pick one thing, make sure you know your blood pressure readings and make sure you get those under control if they're high. One thing I do tell my patients about frequently is the ability for them to check now their blood pressures at home. We run into situations, of course, patient coming into the office, maybe they had trouble finding parking, had to run to the appointment. You find that their blood pressure is high, and because that's the one thing we want to make sure we're keeping an eye on. But the flip side can also be true where it looks okay in the office, but it's actually running high at home, and that to me is a more dangerous situation because it's silent, you're not going to feel it, and then you're going to be running these high blood pressures that are uncontrolled. So now, fortunately, we have the technology using blood pressure machines. The ones that tend to go on the arm tend to be a little more accurate than the ones that go on the wrist. But really, really useful tools in your care, and keep a little notebook of what those blood pressure readings look like. When it comes to measuring blood pressure at home, there's a technique that you guys should know about. Try to take some rest just before. Make sure you're waiting 30 minutes before, if you've drank alcohol or if you smoked or if you've exercised, to make sure you're getting an accurate blood pressure reading. Rest a bit before taking that reading. Then sit with your legs uncrossed, back supported, feet on the floor, and arms should be at about heart height. Then, utilizing these machines, very, very easy. You put the machine on, just click a button and it'll give you those readings. And so again, very, very valuable. Oftentimes when people are first measuring their blood pressures, maybe measure it about twice a day, and then you utilize that information. Bring that notebook with you to your appointments so your doctors can review it. Another message that I know both ourselves as physicians as well as the American Heart Association have been very vocal about is the amount of sodium intake. We know that overall in the United States there's a far higher consumption of sodium salt that leads to high blood pressure, and this excess use is leading to a lot of the problems we have with this high blood pressure. You can see here the recommended daily sodium intake is about 1,500 milligrams. The average intake in the United States is actually double that at 3,300. So being aware of the salt content, when you're at the dinner table, avoiding putting more salt onto your food, being careful about the amount of salt that you cook with, and as well when you're going out to eat, just recognize that as you're buying different foods or going out to eat a lot, oftentimes that contains a lot of sodium. So being aware of what you're eating is going to be really, really important. So again, taking your medicines as you should be, watching that diet, exercising regularly, and stopping smoking. Exercise, can't emphasize how much this is important for the body. We recommend at least 60 minutes a day of good physical activity. Make sure you're doing your stretching so you don't pull anything, but really work about an hour a day, and that'll help control a lot of those risk factors that we've been talking about. So on behalf of myself, Dr. Lynch, and Dr. Krall, we want to thank you for your time and attention to this evening. Again, remembering that stroke is treatable and preventable. Make sure you're taking care of yourself as well as your loved one's risk factors. Promote that healthy lifestyle. And know those signs and symptoms of stroke. Remember that FAST acronym, F standing for facial drooping, A standing for arm weakness, S standing for speech difficulty. And remember that T is in there. That's a time to call 911 and get yourself to medical attention right away so you can get those therapies. And with that, they would be happy to answer any questions. We're going to transition next to the breakout sessions, and we can take any questions that you have.
Now we want to hear from you. In just a moment, you will automatically be moved into the breakout room you registered for. You will have 15 minutes to ask your most pressing questions of our physicians from the Cleveland Clinic. After 15 minutes, you will automatically be brought back into the main program.
Thank you so much, Doctors Corral, Lynch, and Hussein. Good evening, everyone. Thank you for joining us tonight. My name is Sonia Vesmar. I am the Vice President of Community Impact here at the American Heart Association. So we're going to get started. We actually have had a couple questions coming in. And so if you have some more questions, please remember to type them in the chat box and we will get to them and share them with the doctors. So our first question we have, I see in the chat box in our Zoom meeting, I'm going to ask this to Dr. Lynch, if you don't mind answering this. Have any blood pressure medications improved so that people do not have as many side effects as they did in the past?
Oh, that's a good question. Yes, the blood pressure medication options are greater than they were in the past. And because of that, physicians are able to tailor the medication to the patient's ability to tolerate the side effects. So there are some medications available that may be able to provide adequate blood pressure control without having the side effects that a person may have experienced in the past. And it's just a matter of working with your doctor to identify the drug that's best for you.
Thank you so much. That's great. We had another question that just came in. It says, what are the psychosocial factors in recovery from stroke? Would you mind taking that one, Dr. Corral?
I think that's a very important question. We often talk about social determinants of health, and which are many. So we talk about the psychosocial factors, other factors like education, economic stability, neighborhood and environment, healthcare, and psychosocial factors are very important. We talk about we know that there's significant data support that those after a stroke who stay in social isolation, who don't talk to people, who are very isolated, do worse compared to those with a better social support group system. It's kind of that concept of use it or lose it, right? So if someone has a stroke that affected their speech, and if they stay isolated, they don't exercise those muscles of speech, they're going to have a much harder time being able to recover. Whereas someone, I tell my patients oftentimes, especially the ones who have speech difficulty after stroke, that you're allowed to be the chatty one. I want your family members and social support group to complain that, this person just doesn't stop talking. No matter how you talk, it may not be correct, but keep talking, because the first 90 days after a stroke is prime time to help recover. Other psychosocial factors, especially the social factors, when we talk about patients with education is another major psychosocial factor, and so patients with lower education who don't know what are the right things to do for recovery, for example, do worse. When you don't know what you got to do, obviously you may be deprived of so many resources that may be available to you. We know that low household income, living in areas of poor public health infrastructure, high poverty zip codes, lack of health insurance, living in health professional shortage areas, all of these factors are associated with worse outcomes. Oftentimes, people who have either low access to care or low affordability, low household income, they can't afford either follow-ups with their medical team, enough physical, occupational, or speech therapy sessions. Oftentimes they get less sessions compared to those who have more affordability. So all those factors definitely can affect stroke recovery. And then lastly, the psychological factors of it too, right? Those who have, we all try, especially in the younger patients, always try to emphasize picking up depression after stroke. And Dr. Hussein talked about a lot of that in his talk as well. He touched briefly on that, it's a very common thing, which is often missed. And it's very important to talk about depression, not just of the patient, but of their caregivers, and address that early on. Or studies about outcomes have shown that those who are started on antidepressant medications, or even get therapy for their depression early after stroke, have a better chance of recovery, because when they're more motivated and they're happier, they're able to be more motivated to participate in rehab, which is then associated with better outcomes. So it's important important, particularly in the younger patients, to address the psychosocial aspects, because these are patients who, they are out of work. Their financial infrastructure all of a sudden turned, completely upside down. They may have been the head of a household, or an integral part of the family. For example, a mother providing, for her children, and for being a homemaker, or providing other support to the family. All these psychosocial aspects are very important, and we try to address these, especially in at least the hospitalization when the patient is admitted for a stroke, and if not then in follow-up, so that these patients have resources available to them which they can make use of. I hope that answers your question. Thank you.
Thank you. That actually was really informative, and really just kind of shines a light on how important it is to be mentally healthy, to support just being physically healthy. So thank you. We've had actually quite a few questions come in. So I'm going to actually direct this to Dr. Hussein, if you don't mind taking this question, which is, some African Americans have negative reactions to, I'm hoping I'm pronouncing this correctly, lisinopril as a treatment for high blood pressure. Is there a good alternative to this medication?
Yeah, it's absolutely. I think it's good evening, everybody. It's a really, I think a lot of work still needs to be done to understand those racial ethnic differences between the blood pressure medications. We actually do know from data that medicines like lisinopril, the ACE inhibitor class of medications, may not be as effective in the African American population. So typically we'll actually utilize calcium channel blockers, things like amlodipine, or diuretic type medications like hydrochlorothiazide for the African American population. Now, there are some caveats to that. In certain situations, for example, if someone's diabetic and needs kidney protection, those medications still may be the most valuable. But I think that, yeah, you absolutely, good observation there, that in certain populations, we have to be careful about the choice of medications. Fortunately, there's a lot of great choices out there now, and a lot of great ways to treat blood pressure. So we do have a lot of different medications at our disposal.
And let me piggyback on that as well. Because one of the questions came in, are there people of color that are participating in clinical research trials for hypertension?
Absolutely. Great question. And I think this is another important aspect that's being recognized as the research that's being done in these areas, that we need to be inclusive of more people of different ethnic backgrounds. And so certainly as we come into the new wave of clinical trials that are going on, there is an effort to really try to include more, but both aspects, racial and ethnic diversity, and also gender, because we know women, for example, have been a little bit underrepresented in clinical trials. And so making sure we understand women and how they maybe respond differently to different blood pressure control and other stroke risk factors is a really important area of research that needs to continue to occur.
Great, thank you so much. Dr. Lynch, one of the questions asked was, are blood thinning medications and healthy lifestyles the best defenses against stroke for someone who has AFib?
Yes, very good question. Definitely a healthy lifestyle is extremely important. And by that, we're talking about healthy eating, low salt diet, plenty of vegetables, and avoiding a high animal fat intake. But also, it is important to work with your doctor to decide whether or not a blood thinner is appropriate if you have atrial fibrillation. And that really does need to be done in conjunction with your physician. Some patients will need to not be treated with a blood thinner. And there are surgical options as well. So blood thinners are very effective for prevention of stroke with atrial fibrillation. And it is the most common drug or most common treatment for this problem. But there are other treatment options, and it's best to work with your doctor to determine which treatment option is best for you.
Thank you. So, Dr. Corral, this next one's for you. Can you address the warning signs of high blood pressure? For example, swelling ankles, headaches, and nosebleeds, since that can lead to stroke. I know we have, like, on our background here, how to identify a stroke, but can you address some of the warning signs of high blood pressure?
Yeah, great question. Oftentimes it has no warning sign whatsoever. People can, and that's the more dangerous part, people can come into their medical visit and have blood pressures that are very high, but they feel fine. So people who have blood pressure elevations chronically for over long periods, oftentimes they get used to that high blood pressure and they don't have any signs of high blood pressure until, unfortunately, they present with a large brain bleed or a ruptured blood vessel. It's normally the patients who are not used to such high blood pressure and have major fluctuations who have signs of high blood pressure, and those are usually headache is one of the most common, dizziness, wooziness, lightheadedness. Normally, some of the symptoms that you mentioned, like ankle swelling, nosebleeds, etc., these are not typical signs of high blood pressure, but it's normally headache is perhaps one of the most common ones, or just feeling sort of really anxious, feeling really heavy-headed, or your head is really sort of all over aching. That's perhaps one of the most common symptoms. But therefore, as I mentioned, since it often comes without a warning sign, it's very important that you have regular checkups. You can get a blood pressure cuff machine at home, and check every so often as well. So it's important to acknowledge that it may not always have warning signs. Get your blood pressure checked regularly.
And so to go along with that, what about if someone is always has low blood pressure? Like often, is that something you should be concerned about?
So we always have to have a certain minimum blood pressure level, which is a healthy blood pressure level, in order to maintain blood and oxygenation to the brain. As long as we're above that basic bare minimum level, one should be okay. We run into trouble is when people have blockages in the arteries, particularly in the carotid arteries of the going into that are supply oxygen from the heart up to the brain, because there are passages that supply that. If people have blockages in those carotid arteries, then that low blood pressure can actually, only say if there's 50% blockage, only 50% of that low blood pressure is being perceived by the brain. So yes, low blood pressure on its own, as long as it's above a healthy limit, is fine, as long as it's not too low. But particularly in patients with blockages, it can cause signs of stroke. And I know there's a question here asking about what to do about it. There are medications sometimes that can help keep the blood pressure up, but most importantly, hydration.
Thank you. So we have about a couple more minutes. So I'm going to try to get in one more question. And Dr. Hussein, if you don't mind taking this. The question says, I'm hearing about strokes occurring with childbirth, either pre-delivery or postpartum. Are you seeing an uptick with birth? And do you know what might be causing this outcome with this generation of mothers?
Yeah, it's we've actually, this is an area, or we've seen, unfortunately, I shouldn't say unfortunately, it is a known risk that clotting is more common in pregnancy and in the immediate post-pregnancy period. And so I wouldn't necessarily say that there's been necessarily an uptick in the amount, but it's definitely something that we should be aware of. Fortunately, not to, again, frighten anybody, it's not that it's a very, very high risk. So most pregnancies, people will do just fine, won't run into clotting issues. But it is something to be aware of, especially as medical professionals. We have to be aware of this category. It's usually occurring towards the end of pregnancy and into the the first 6 weeks postpartum is that highest risk period. One of the particular concerns is it's on the vein side of the circulation. You get a clotting issue, which involves the main draining veins of the brain. And so that's something to be, try to be aware of, watching out for signs, including severe headache or any of those fast symptoms that might develop. And these are patients that might need blood thinners in that period of time. So definitely something, again, this is another area where more knowledge is, being acquired every day. The area of women and stroke and how it affects them, particularly with pregnancy and other hormonal changes, is a very, very interesting area of discovery that we're in right now.
Thank you so much for that answer. I know we have some other questions. Unfortunately, we're out of time because we want to keep the show moving, but we will try to take the questions down and get the answers to you as a follow-up when we send out a recording with this video. So thank you so much for your time and attention, and I will kick us back to the show.
Thank you so much for such an informative and engaging session. I think everyone here can say we all feel more informed about how to spot a stroke, what to do, and who to call. These doctors are amazing. And we learned about the latest advancements in stroke care and research. Lastly, we know that there can be life after stroke. Which brings me to our next guest, an inspiring stroke survivor who is here with us tonight to share her story. It is my pleasure to introduce Cody Pride. She is a joyful woman who is blessed to be a wife and a mother. She works as an occupational therapist, is also a minister, and has founded a faith-based foundation. Cody?
Good evening. I am so honored to be here with you today. I have the opportunity to share my story with you. February 13th, 2015, the unthinkable for me happened. I was 34 years old. I work at a critical care hospital as a therapist. I'm working with my patients. Every day I work with stroke patients. And as I was working, I had a headache that would not stop. I remember saying, there is something wrong, but of course I have to keep going through work, and I just wanted to get through my day. It was a Friday. I said, when I'm done, I'm going home. I'm ordering pizza for the kids, and I am getting in the bed because I'm exhausted. And I remember taking Sudafed, and then I took another Sudafed, and then I took an aspirin, and my headache just wouldn't get any better. I sat down at my desk, and I began to write notes, charting about my patients, never knowing within hours I would be a patient. I looked over to my therapist, a good friend of mine, and she says, Cody, you don't sound good. In my mind, I sound great. I just want to get out of here. I want to go home. And she says, I don't know, you don't sound well. I said, well, my head is pounding, it's aching. I felt like I couldn't even think. And my boss, who's also a speech therapist, she looked over and she said, you're slurring your speech. And I'm like, this doesn't even sound right. There's absolutely no way they're telling me I'm having stroke-like symptoms. I'm 34 years old. I just have a headache. It's probably a migraine. So they asked what they could do, and before you knew it, I went from the critical care hospital, and I was in emergency. Immediately, I'm being triaged, and of course, you can understand, I'm in healthcare, so I'm understanding what's happening. I just don't know why it's happening to me. I just have a headache. I need to get home. I want to get in my minivan. I want to get home to my children. I want to go to bed. And I remember saying, what's happening? And the nurse looked and he said, ma'am, we believe you're having a stroke. Okay, first of all, I'm not having a stroke. There's absolutely no way. And I remember continually trying to tell him I just have a headache. He said, ma'am, I don't understand anything you're saying. And that was the moment that my entire life flashed before my eyes. Because what do you mean you don't understand what I'm saying? And then I start thinking of all his medical things. I'm going to a CAT scan. If I am really having a stroke, is this the beginning of something that am I gonna end up at the hospital needing rehab, or am I gonna die? I have 4 beautiful children. I have a wonderful life. I have a critical care daughter of my own, and I'm her advocate, and I can't even advocate for myself. That was the first thing that I felt like my stroke took from me. So before you know it, I went from the emergency room to now I'm being admitted. My parents came in, I had a facial droop. I remember my dad said, I can't believe you're having a stroke, you're so young. And if you've ever seen your parents who think they're the ones that might have an ailment, I'm always taking care of them. And that was the first time they looked at me like they may have to take care of me. I'm blessed. I have friends and family in the medical field, so they came and everything I couldn't say, they said. So I stayed there. I got my heparin shots in my belly. They did neural checks every hour. I got through the first 12 hours and I thought, okay, I might be in the clear. And the doctor says, no, we need to get through 24 hours and we're waiting on your CAT scan and you'll see the neurologist tomorrow. Well, the neurologist came and I remembered I just was like, he's gonna tell me what's wrong. I'm sure there's a quick fix. I'm sure something has happened. And he said, well, you were taking all of this medication and you have so much stress. You work, you have 4 kids and you have a child that has special needs. I'm sure there's just this neurological storm you're going through. You just have to rest. And I'm thinking, then every mom in America must need to rest. What are you saying? I can't talk. I can't talk. Was Friday morning the last time I was able to tell my kids I love them? Was the last patient I just talked to, was the last one I will ever treat? I couldn't even articulate to him, there's something wrong, there's something more. And then I remember my admitting physician came in and he sat down. Now we're at February 14th, Valentine's Day. In the most loving and amazing way, he said to me, you've had a small stroke, but we believe from your CAT scans that you're gonna be okay. I was released a couple days later, back home, still not able to truly articulate. I felt kind of unintelligible with my conversations, but I wrote, and in my own way, I did some sign language, and eventually everything recovered. Now, I feel many times like I'm one of the lucky ones. I survived, I have thrived after my stroke. But my responsibility didn't end because I promised God, if I get my voice back, I'm gonna advocate for every patient that is unheard. Because I was 34 years old, 34. And I could have went home and went to sleep and never woke up again. My stroke could have progressed, but it didn't. I can tell you that the next 5 years were pretty scary for me because scientifically, you have a higher risk within the 5 years to have a greater stroke. So I thought about that. My insurance, my life insurance, it was affected because now I have this on my life insurance. I'm 34, what do you mean? I was just beyond myself. But in time, I was able to work. I was able to speak up. I was able to advocate not only for myself, but for others. Because the truth is, strokes, TIAs, no matter how small, how big, it doesn't matter. Your age, your gender, your job. It doesn't care if you have children, if you have a vacation planned. It doesn't matter. It can happen to anyone at any time. Again, I count myself so fortunate that I was at the hospital where people knew the signs and the symptoms of stroke. So I did get quick care. And now I don't have to go to the neurologist every 6 months. Every year I've been cleared. I'm not on a blood thinner anymore. But I will tell you that stroke doesn't just affect you physically. Mentally, emotionally, I had to learn to trust my body again. Because the one thing that happened with me and the one thing doctors were not able to explain is why. I know the what, I just don't know why. So therefore, I have to be proactive. I will say that I'm big on my self-care. I make sure I get enough rest. I keep all my doctor's appointments, but I also know that I have to advocate for myself. I have to say, you know, if this is a headache or something going on with my body, that I can't say, well, just my age, it couldn't be that. It could be. And sometimes at moments like this, all of those emotions flood back because I'm extremely grateful. I'm extremely humbled. But I will tell you, from being a therapist and seeing day in and day out, there are so many people that are dealing with their family members, their loved ones that have dealt with stroke, and they don't always get their voice back. They don't always fully recover. But we can do something. We can help prevent. We can help share our stories. So I guess if I were to say anything, I would say learn the signs and symptoms of stroke. I would say know your body. I would say to you, get help, get checked out. I'm so thankful for the healthcare system and those that listened and took my signs and symptoms serious. Because not only have I survived, but I also have a life where I can continue to tell a story of living and not just surviving.
We just heard an inspiring story from an amazing young stroke survivor. You can support the life-saving mission of the American Stroke Association right now by getting out your cell phone. Your support leads to earlier detection, faster treatments, more lives saved, and fewer people suffering the devastating effects of heart attack and stroke. Please consider making a donation by texting POWER-CLE to the number 41444. That's POWERCLE, all one word, to the number 41444.
Thank you, Cody, for opening your heart to all of us this evening. Up next, it is my honor to introduce Dr. Oge Izumakor, who is a general adult psychiatrist for Metro Health Medical Center and an assistant professor of psychiatry at Case Western Reserve University School of Medicine. Dr. Izumakor is here to share information and answer your questions about how mental health can affect our physical health. Following our mental health session where you're encouraged to ask questions, it will be time to reclaim our rhythm and soul. We're going to ask you to get up and get your heart pumping with Kendra Willis as she shows us some exciting dance moves. And after we dance, we will then be delighted to welcome the musical duo Black Violin, who've combined their classical training with hip-hop influences to create a distinctive, blended sound described as classical boom. The Grammy-nominated album Take the Stairs debuted at #1 on the Billboard Classical chart as well as the Billboard Classical Crossover chart. You may have even seen them performing at Cleveland's own Playhouse Square last night. On behalf of the American Stroke Association, it was truly our pleasure to have you join us this evening. We hope, after everything you have learned tonight, that we inspired you to reclaim your rhythm and soul. Remember, even the greatest journey begins with a single step. Now, Dr. Izumakor, the floor is yours.
Hi, everyone. Can everyone hear me?
Yes, we can hear you great. Thank you, Dr. Izumakor.
Perfect. Welcome to the mental health section of the event. My name is Dr. Izumakor. I'm Assistant Professor of Psychiatry at Case Western Reserve University Metro Health System. And I will be talking with you today about the mental health effects on your physical health. this is a wonderful topic today for us to talk about, because a lot of people do not know that this is even a thing, and people who do know somehow do not know how this works. And so one thing that I wanted to state first is our mind and body are not separate. They are intertwined, and that's a fact. Research has shown that people with mental health conditions are more likely to develop physical health problems such as heart disease and stroke, like we've heard. And so there are different things that are implicated in how this happens. Genetics is one of them. And we do know that a lot of genes that predispose us to physical health conditions have also been implicated to in the development of some mental health illnesses, and also chemicals that have been found in certain physical illnesses have also been found in certain mental illnesses, such as cortisol level increase. We do know that in heart diseases and things like stroke, hypertension, there's increase in cortisol level, and that has also been found in mental health illnesses such as depression and anxiety. Low vitamin D levels have also been implicated in depression, as we know. Low motivation, low energy, those are symptoms that are found in people who are depressed. And this would lead to an inability for people to care for themselves, and this negatively impacts their physical health. Poor concentration is another symptom that a lot of people with mental health illnesses will present with, especially depression, anxiety, and that causes them to be unable to think clearly and make healthy decisions. And so things about pertaining to making appointments and keeping to their doctor's appointments might not be something that they'll be able to do when they have these issues with concentration. And we also do know that people with mental health illnesses, they have a likelihood of defaulting to alcohol and drug use for temporary relief. And these substances we know have been implicated in impacting negatively on our physical health. And so that is something that also causes, it negatively impacts our physical health. Chronic stress is something that over time will affect our physical health. What happens in stress is there's an increase in cortisol, like we know, and so there's predisposition to physical illnesses such as diabetes, hypertension, heart diseases when you have chronic stress going on. Okay, and there has been a study at the Harvard School of Public Health that talked about the affectation of emotions, our emotions on the physical health. And so specifically, positive emotions like optimism has been correlated to reduced risk of heart diseases and reduced rate of disease progression if you already have diseases. Negative emotions such as anger have also been found to correlate to increased risk for heart attacks and also physical problems. And so this is what we call the power of positive emotions on our overall well-being. Very, very important. Now, how do we go ahead and create a healthy mind and body? Because this is really important in being able to take care of our physical health as well as our mental health. We cannot overemphasize the importance of exercise. And I know that Dr. Hussein has gone a little, into exercise. Exercise is really, really important. You don't have to really go to the gym or, do all the complex routines. Little things like brisk walking, just jogging. Find time to include physical activity in your daily schedule. Consistency is really key. it doesn't matter if you're able to do this every day. The fact that you're able to do this a few times a week and consistently is really, really important. And so exercise really, really helps to speed up your heart rate. It speeds up your breathing. And then there's a calming effect that you get when this is over. And that kind of acts as a reset button to help your body to feel recharged. And so this is something that really benefits, especially people who have anxiety. If you're someone who has anxiety and you're able to engage in regular exercise, this pattern of having your body reset and be able to recharge and have this calming effect is something that's really, really gonna benefit you over time, because it does reduce your anxiety level. As well as people who have depression, we do know that when we exercise, our bodies release endorphins, which are chemicals that really help with regulating our mood and elevating our mood. And so exercise is really, really important. Another thing is balancing our diet. Okay, eating more fruits and veggies and whole grains and less of high calorie foods like high carbs are things that we really need to pay attention to. Basically, health conscious eating. Maintaining healthy weight is really, really important. Healthy weight is important. And so you get this between exercise and maintaining a balanced diet. Your weight is really maintained. Okay, and the next thing that I really want to emphasize is sleep. We sometimes do not understand how important sleep is. Sleep is a really good factor in how we present mentally and physically. We all, I'm sure, have experienced a time where we did not sleep well. We woke up in the morning, we feel like crap, and it was all trying to lash out on anything and everyone around you, not able to concentrate. Imagine that this is something that happens very often, maybe on a daily basis or every other day. This is going to potentially affect your mood, your personality, and your overall mental well-being. And so you want to make sure that you're getting good sleep. When you sleep, you're allowing your muscles to recharge. You're allowing your muscles to get toned. You're allowing your brain to settle and recharge. Your body gets really ready to take on the stress for the next day. Mindfulness practices is one of the things that I've found to be really effective. Some people wonder what mindfulness practices really are. It's not as complex as people think it is. It could be something very simple as just being in a quiet room. You could shut off the lights, or you could, dim the lights. But what you really want to do is, because we always have all these things going on in our heads, squirrels were here and there. We're thinking of what happened yesterday, what didn't go well today. Mindfulness practice helps you to be able to block off all of these things, puts you in a state of calmness where you're able to focus on yourself, your body, your mind, your breathing, without thinking of anything that could potentially stress you out. If you're able to incorporate a few minutes of your day practicing mindfulness, that is really a great practice, because what it does is it provides you that calming effect that you need to take a break from all the day hustles and be able to come back and kind of face things with a different mindset. Avoiding alcohol and drug use. Again, these are substances that could potentially affect your mood. They could, affect your personality. They could actually trigger some of the mental health illnesses that people develop, such as depression, anxiety, even psychosis. And so it's really, really important to be avoiding abuse of these substances. Now, I would really, really encourage people to try to seek professional help. Sometimes it's really overwhelming when you have a lot going on and you don't know where to turn to. You see that things have overwhelmed you. It's really important to start talking to your doctors so that they might be able to refer you to a mental health specialist and you can get evaluated. Also, really, really important, follow up with your primary health physicians for your physical checkups. You want to make sure that you're managing your physical health conditions. If you have high blood pressure, if you have diabetes, if you have any heart condition that needs to be managed, please make sure that you're following up. These are the ways that you're going to be able to maintain your physical health and also make sure that the stroke that we talked about today is able to be prevented. Okay, and so in recap, I just wanted to put a little diagram here. This could be any one of us here, and we do know, like I said, we have stressors, we have struggles, we come across a lot of things every day as we work, as we go about our ways. It could be loss of a job, financial difficulty. You could have a sick family member that you have to care for that is really draining. You could have a loss of, a loved one, which a lot of people have witnessed during this pandemic period. It could be depression, it could be anxiety, worry, negative thinking. What you really want to do is that as you're going through all of these things, that you're practicing the things that we've talked about. You're having a positive mindset, you're being optimistic, you're having positive self-talk, you're not really engaging in catastrophic thinking, which is negative thinking about everything. It starts with one little thing is going wrong, and then the next thing you're thinking the whole world is going to end. You're thinking this is going to be wrong, this is going to go wrong, this is going to go wrong, and then that's called catastrophic thinking. What that does is it increases your anxiety level and it increases your depression. And so you want to make sure that you're really practicing optimism every day. Exercise, of course, really important. Health conscious meals, maintaining healthy weight, getting good sleep like we talked about, and having this mindfulness practice that we talked about. If you're going through any kind of stressor, it's really important that you're combating all of these stressors with the coping mechanisms that we talked about. And you're just going to come out like the guy on the right, a victor. And so what we want to do is have everyone be able to go through these. We've just listened to one of our advocates and talking about how she emerged a winner through her struggles. This is something that we want to hear. These are the kinds of testimonies that we want to be a part of. And so it's not something, there's never a time that you need to start. It's never too late. If you have not been practicing some of these things that we talked about, it's really important. Today is a good day to start. Tomorrow, next tomorrow, do not put it off. What really matters is that you're being consistent, that you're being persistent, and you're gonna see little drops of benefits. You might not see the benefits a lot in the beginning, but little drops of water, they say, make an ocean. And so over time, you're gonna see the benefits of the healthy lifestyle that you've adopted. Thank you for listening.
Thank you so much for that amazing presentation. I really appreciated the fact how you talked about how important it is to take care of your mental health in order to have good physical health, which just ties into our earlier conversations with the Cleveland Clinic doctors. So one of the questions that we had that came in from Facebook is, if you don't mind answering, Dr. Izamacore, is, are there any kind of physical symptoms that can manifest from mental health issues? And I know you mentioned a little bit, in your presentation, but are there any physical symptoms that someone may not consider that they, should say, hey, if this is happening, this might have to do something with my mental health?
That's a great question. Thank you for asking. The thing is that a lot of people actually present first to their primary doctors when they have mental health illnesses, because sometimes all they have are the physical symptoms. So for example, people who have depression might notice that they're feeling fatigued and tired and headaches, abdominal discomfort. For people who have anxiety, they feel nauseous, vomiting. And so you might not have the typical symptoms of, these mental health illnesses. You might have the physical symptoms. And so it's really, really important to understand that these mental health illnesses also manifest with physical illnesses. And what usually happens is you go to your doctor with all these symptoms, and then they run tests, they evaluate you, and they couldn't find anything. And then they send you to get evaluated psychiatrically. And that's when we determine that you're probably suffering from depression or anxiety. And so those two are the big ones that we know can manifest with a lot of physical symptoms.
Thank you so much. Well, it's about 8:50, and unfortunately, we're going to have to wrap up this session. But if you do have any questions, please feel free to type them in the chat box, and we will get those answers to you after the show. I want to also just take a minute to once again thank you, Dr. Ismakhor, for your time and your expertise this evening, as well as Drs. Lynch, Hussein, and Corral for just taking time out of your busy schedules to share some really important information with us this evening. And I would be remiss if I didn't thank Cody for just taking the opportunity and the time to share her story with us. It was moving, and it was hard for me not to come back on with tears in my eyes. So thank you so much. Up next, we are going to lift up the evening, and we're going to have Kendra teach us a couple little dance moves. And then after that, we're going to roll right into our Grammy nominated feature this evening, Black Violin. And then after that, you are free to the evening. So I just want to say thank you everyone for your time and attention. Please feel free to get up, have some fun, and move with us in the next couple minutes. And I will kick it over to Kendra.
Hello, and welcome to tonight's Power to End Stroke Cleveland's event. We are encouraging you to just get moving. Are you enjoying yourself? Absolutely, because I know I am. We just spent the last few minutes, an hour actually, to kind of learn a lot about strokes and all the signs and symptoms. You also need to know your FAST. You know exactly what that is and how you can kind of make sure your body is doing what it needs to do. Tonight, we're going to get moving with just a little dance. We all love dance. We all love music. So this is where we bring it all together. We're going to warm up with just a few steps, and we're going to get moving. Now, before we do that, we want to kind of work on our breath work. Breath work is very, very important to just kind of feel your heart and know that your heart is being healthy. Now, what we have to do, I want you to just take a moment, put your hand over your heart, and I want you to just kind of hold yourself here. I want you just to take in a few breaths, just a few deep breaths here, and just breathe it in and breathe it out. We're going to do that one more time. Breathe in and breathe it out. Sometimes we have to be audible. That fills our lungs and that makes us just kind of feel really good about getting that circulation going. So I want you to now, before we get moving, I want you to do me a favor. I want you to play full out. I want you to just have fun. I want you to just move your body. Don't worry about getting it right, because we don't always get it right. If you mess up, catch up. Let's get moving. All right, we're gonna first start with a few steps here. I want you just to kind of feel the music as we kind of go along. And we're gonna start with a little salsa movement, just to warm up our bodies, okay? We're gonna start with our left foot, and we're gonna 1, 2, 3, 5, 6, 7. 1, 2, 3, 5, 6, 7. 1, 2, 3, 5, 6, 7. Just left, then right. 1, 2, 3, 5, 6, 7. 1, 2, 3, 5, 6, 7. I hope everyone's moving. 5, 6, 7. Feel good. 5, 6, 7. 1, 2, 3. Count it out. 1, 2, 3. 5, 6, 7. 1, 2, 3. 5, 6, 7. We're going to turn in just a minute with that right foot, left foot. Let's do that right. 1, 2, 3. 5, 6, 7. All the way around. 1, 2, 3. 5, 6, 7. 1, 2, 3. 5, 6, 7. All the way around. One more time. 1, 2, 3. 5, 6, 7. 1, 2, 3. 5, 6, 7. 3, 5, 6. To the left. 1, 2, 3. Do it again. All right, I see you moving out there. Let's go to the left this time. That's this way. 1, 2, 3, 6, 7. 1, 2, 3, 5, 6, 7. Always move your arms. Again, this is you feel your body pumping. You feel your body moving. This is up to you. All right. There we go. Let's turn around. Side angle. Here we go. Up. 1, 2, 3. 5, 6, 7. 1, 2, 3. 5, 6, 7. Go back. 1, 2, 3. 5, 6, 7. One more. 5, 6, 7. Back to the middle. Let's do it. How you feeling out there? It's time to get active. Stay healthy. All right. Now that we're warmed up, let's take a minute. See how you're feeling. Check your body. Set your intentions on how you're feeling tonight. I hope you're moving out there. Don't worry about messing up. Let's keep moving. Now that we have our movement going on, we're going to kind of get moving with a little line dance. And we're going to show you some instructions right before we kind of get the music going. Okay, so I want you to first think about what your body is doing. We're going to start from our feet and we're going to work our way up to all the way feeling it with our hearts. Okay, so first we're going to kind of start with our first right foot, and then left foot. So it's kind of a heel to toe action. Really, really easy. Again, do what your body allows, no pressure. Okay, so right foot is heel, toe. Left foot, heel, toe. Right foot, left foot. So that's 4 times we're going to go heel, toe. I'm going to show you from this angle, and it's going to right foot, left foot, right foot, left foot. But I want you to kind of feel that. I want you to kind of get excited about this movement, right? So right foot, left foot, right foot, left foot, kind of heel, toe. Now, from there, we're going to go to the right, and it's going to be a grapevine. We call that grapevine. All you're doing is moving to the right and moving to the left. It's up to you on how you want to do that. Okay, we're going to step, back, step, together. Step, left, step, together. Okay, and we're going to do that 4 times as well. So it's going to go heel, toe, heel, toe, heel, toe, heel, toe. Right step together, left step together, right step together, left step together. Okay, and then what we're going to do from there, we're going to move on back. So we always like to say kind of we can wiggle our shoulders or we can just kind of move on back. So I want you to be cool when you move back. All you're going to do is 1, 2, 3, 4. Step back 4 times and you're on there. It's going to start from there. All right, let's start from the top. All right, right heel toe, left heel toe, right heel toe, left heel toe. Let's grapevine to the right. Together, left. Together, let's right again. Together, left, again, and then we're back 2, 3, 4. All right, and that's all we have to do until we get to moving. Now, this is my favorite part. We're going to go 4 walls, and you're going to go step, turn, step, turn, step, turn, step, together. Okay? Now, if you feel a little groovy, you can kind of work it around. And you work it around, work it around. And then we start all over again. It's up to you. All right, let's put it all together and see what we have. So we're heel, toe, heel, toe, heel, toe, heel, toe. Grapevine, right? Together. Together, right? You got this. Back it up. 1, 2, 3, 4. Let's turn it out. 2, 3, 4. I think you got it. Are we ready? Yeah. I think you're ready. Okay. Right foot. Left. Grapevine. 4. 1, 2, 3, 4 again. Let's do it. Back it up. Turn it out. 1, 2, 3, 4. Let's kick. Kick it out. To the right. To the left. Turn. Kick it out. 1. To the right. To the left. To the right. Back it up. Turn it out. Let's kick again. To the right. Come on with me. Do it again. Back it up. Turn it out. Let's kick again. To the right. Back it up. Go low. Over again. Back it up. Turn. One more time. All right, what you doing over there? I see you. One more. Back it up. Woo! Oh, we got that heart pumping. Give yourselves a round of applause. You did it. Yes, yes, yes. I'm so happy you were able to line dance and get moving with salsa and line dancing. It is our duty to just keep moving. We want you to stay active and stay healthy. Be sure to stay connected to the American Heart Association Cleveland. It's making an extraordinary impact on the lives of those in Northeast Ohio by encouraging a lot of people to do all the things that keep their lives healthy. Don't forget, keep moving, keep doing the life-saving work that promotes healthy living.
If you weren't expecting a quiet violin performance, well, that's not really our thing.
That's not what we do.
So we encourage you to start swaying in your seats or even start standing up and dancing, because this is a party. You ready to jam?
Let's do it.
Stereotype. Standardized mental picture.
Welcome, ladies and gentlemen. Black violin.
Predecir el comportamiento de una persona basado en su raza o nivel social. Estereotipo.
is the day when I finish the race. I'm making somehow, no matter how long it takes. This is the day when I go all the way. I make it my own and say, here's to the dreamers. Cheers to the dreamers. Here's to the dreamers. Where are the leaders? Listen, yes, I'm a dreamer. This is the time when I make my own eyes. Gonna reach up my hands and pull down the stars. This is my time, it's been coming so long. I see it now. Hey, here's to the dreamers. Put your hands together. Hey, cheers to the dreamers. Hey, cheers to the dreamers. Where's all the leaders? Listen, yes, I'm a dreamer.
See, sometimes we can't say, I can do that.
Listen to the words.
But what we can say, that I can have my dream. And that dream that you're holding in your mind, that it's possible. Let's say that together, please. Say, it's possible. It's possible.
Here's to the dreamers. Hey, cheers to the dreamers. Woo. Here's to the dreamers. Hey, where's all the leaders? Listen, yes, I'm a dreamer.
Thanks for having us and for all of your generosity tonight. Cheers to you and all you do to make our communities healthier.